How to help a cat give birth. Part 3. Assisting after labor. 1. Make sure that the kittens nurse as soon as possible. The early milk contains valuable colostrum with antibodies for the kittens. Be aware that kittens are both blind and deaf when they are born, so they will be seeking out the mother's nipples by smell and touch. Sometimes they do so right away, and sometimes they wait several minutes while they recover from birth. The mother may wait until all of the kittens are born before allowing them to suckle. However, if the mother appears to reject the kittens and refuses to allow them to nurse, prepare the milk powder you purchased and feed the kittens yourself using a kitten fostering bottle. If the mother is allowing the kittens to nurse but there's a problem with the milk coming in, you may see the kittens attempting to suckle and meowing instead. If no milk seems to flow, see the vet, who may be able to stimulate it, and in the meantime feed the kittens the milk powder using a kitten fostering bottle. 2. Look after the kittens' health. After the kittens are born, keep an eye on them to make sure they're adjusting and settling in normally. If a kitten makes choking or gurgling sounds, it has fluid in its air passages. Hold the kitten between your hands with the head on your fingertips. Think of making a sling from your hands. Gently swing the kitten downward. This will help to force the fluids out of the kitten's lungs. Use a gauze pad to wipe its face. Be sure to use gloves, but be careful, as a newborn kitten is very slippery. If the mother cat appears disinterested in her kittens, try rubbing her scent onto them. If she persists in not being interested, you may have to care for the kittens yourself. This will involve constant feeding and an incubator. It is too involved to explain as part of this article, so seek your vet's advice. Don't be alarmed if one of the kittens is stillborn, dead. Make sure he or she is really dead, though, before disposing of him or her appropriately. Try to revive a limp kitten by rubbing him or her briskly to stimulate him or her. Use a warm, damp face cloth to rub with. Other things you can try include raising and lowering his or her legs and blowing into his or her face and mouth. 3. Look after the mother's health. Keep plenty of good quality food and fresh water immediately next to the nest after the birthing has ended. She won't want to leave her kittens, even to eat or use the litter box, so keeping them as near as possible will allow her to take care of her needs while still remaining near her kittens. It's particularly important that she eats so that she can keep up her own energy and pass on nutrients to the nursing litter. Try to put the food close by, but keep it separate from the litter tray. Cats dislike toileting near where they eat, so whilst she won't want to leave the kittens, she may be put off from eating if the tray is also too close. For the first day or so, she may not get up at all. Keep the food near her bed if possible. Check on her to be sure she's recovering well from the birth and is bonding with and caring for the kittens. 4. Record each birth. Record the time of birth, the gender, weight, use kitchen scales, and when the placenta was delivered. This information may be useful later for medical records or for documentation if you're a breeder. Tips. When the birthing time is near, consider putting dark sheets and blankets on your bed, because, despite your carefully made birthing box, she may decide that the perfect place to give birth is your bed, because it feels familiar and safe. Do not come near the cat during the birthing until necessary. You may end up being the subject of her bites and scratches. Come to her only if she needs help during labor. Unless you are deliberately breeding cats, consider spaying your cat. For the sake of any future kittens, many unexpected kittens end up feral, starving, or are euthanized, and for the sake of your cat, spaying decreases the risk of having puerperal later on down the road. Puerperal is when the uterus fills with pus after a heat cycle, leading to infection and imminent death if your female isn't seen. Don't interfere with the mother if she is not having problems giving birth. Warnings. If your cat is in labor and if she doesn't have her first kitten within 2 hours of active labor commencing, then you should see a vet immediately, as there may be something wrong. This also applies if there is more than an hour's delay between each kitten. If that should happen, don't panic, as the best thing you can do is to remain calm for the sake of the mother and her kittens, and contact your vet for advice. See a vet for immediately if you notice any of the following warning signs. A first kitten that does not come out following an hour of hard contractions. The mother begins partial delivery of a kitten that proceeds no further. The mother begins to lose bright red blood from the vagina.